Hey there, everybody. Today, we're going to be talking about the pizza tracker experience, 5 strategies to overcome common challenges and create better access in healthcare. Now, you're probably coming to this webinar and thinking, wait, we're talking about pizza? We're talking about the pizza tracker at a place called Domino's. Love the pizza tracker at Domino's. But we know in reality, that's what everybody wants. The healthcare is not actually that simple. The difference between just choosing between pepperoni and pineapple and mushroom versus knowing the difference between 3 different types of MRIs or 38 different visit types, it's just not the same sort of thing. But that's the consumer experience that we all want to deliver for our patients, the pizza tracker dream. I walk into hundreds of different CIOs I've talked over my time here at Luma, and they all say the same sort of thing, which is, I want my consumer experience to be as simple as the Domino's pizza tracker. And it's laudable, it's applaudable, because it's such a simple way to describe from something I want, pizza, to receiving it at my doorstep and having dinner ready. But most healthcare experiences aren't that simple. They often start and end with what's called a digital dead end. If you look at this, fictitious website right here, there is a question, I guess is the best way to say it. What do I do next? There's no easy way to take an action, like schedule an appointment, get a prescription refill, ask a nurse a question. There's good information about the services provided, but the actual digital actions that people come to websites for, completely missing. So without any self-service capabilities on your website, the front door is often not a digital front door. The front door is the phone line. And that's what patients want, honestly. Patients want a consumer experience. There's great data from class research in 2022, which asks patients, asks vendors, and asks healthcare systems, what do you want and what are we delivering to you? And there's a really great opportunity to put the patient's voice at the center of healthcare IT. And you can see very, very clearly at the top what patients want, what providers are spending their energy on deploying, and what vendors have actually built and delivered. There's a pretty big variance between what patients had wanted and what the ecosystem writ large is providing. And that's not great because it leads to gaps in the ability for them to self-serve. So this is one of my favorite things to show folks when I'm doing a webinar or talking to them, which is look at how desirable it is for patients, this N of nearly 9,000, to register and check in for an appointment or schedule or reschedule an appointment. Nearly 100%. Very few things in the world can you ask and get a 100% certain answer. Versus provider adoption and vendor delivery, it's not that great. We're kind of really middling collectively. So to give that, that easy, simple consumer experience for patients, we've got a lot of ground to make up. So if you look at the Patient Access Collaborative, they're a group of academic medical centers across the United States, solely focused on academic medicine and children's care, which was really about, in the quote that Elizabeth Wood, who's the executive director there, said, patients' voices are not being heard. Simply because of that, they're unable to get into the system and get into the beginning parts of that care. So how can we build a better consumer experience? What are the pieces we need to put into place so that consumers and patients, when they want to get access to care, can get access to care? I put an order in for pineapple pizza, may not be my cup of tea, maybe yours, and I get that pineapple pizza a little bit later on. So first, self-service. Right at the top, you see here on Tandem Health's website, and you can see a big old banner that says, you can now book your appointment online. What do we see in the class data? Every patient wants it. Not most systems are not delivering it. Bridging that gap is a big part of delivering this consumer experience. And then big, easy, large buttons about what are the next best actions, easy to find resources, getting ready for that first visit. So you can educate patients on things like my insurance information, what coverages I provide, what carriers I take, all that sort of good stuff. And then other things that might be relevant to your specific experience. So, Tandem Health, Kurt, who's the VP of Business Development there, said it perfectly himself, which is we need to make it easy on the eye and the brain to use our website. If you think about a lot of different ways and a lot of different web studies, they do eye tracking, mouse tracking, and the bigger, the more slabby, the larger the font, the bigger the button that drives that kind of quick consumer self-service experience. Those are the websites that really show that self-service ability that deliver the consumer experience. So let's break down that experience. There are 5 parts to it. And, we cribbed a little bit of the pizza tracker here because honestly, it's a fantastic experience, right? I want pizza, I get pizza. I want healthcare, I get healthcare. We know as healthcare professionals and working in healthcare IT, it's not that simple, but we can use it as a great frame to understand how to break down the 3 main pieces from the moment I want care to I receive care. Bucket 1, which is steps 1 through 3, is access. Bucket 2, which is our 4th part of this, is communication. Number five is readiness. And we'll go into each one of these in a little bit more detail so we can kind of see how you can build this great consumer experience. So let's jump in. The first part for our pizza tracker on our way to getting a patient towards care is what do we want? We want options. So most care experiences start with giving patients the options that they may need to receive wonderful, wonderful care that your providers provide. So without those great options available, there's a lot of different downsides. And many of these may seem kind of obvious, and they are, and that's sort of on purpose, right? We want to highlight to you like the counterpoint to what happens when we don't provide these great experiences. First of all, we'll see really long hold times, which means that all the digital investments you've had for meaningful use on your EHR, your portal, your patient engagement tool, all those don't matter. And what people end up going to is the phones. And when the phones are slammed, that's long hold times, and that's abandonment rate. And then second, patients may say, you may believe that patients don't want self-service tools, or providers may say, I need to have a little bit more control. But the voice of the patient is strong. The voice of the patient is loud. The voice of the patient is unanimous, that patients do want these sort of self-service tools. And then look, if you're in a metro where you're not the only game in town, someone else is offering it down the street. And for you to get that patient, make sure they don't show up somewhere else or go somewhere else, you got to provide that. So when we look to provide great points of access on that first slice of that journey, we need to help patients have multiple points of entry into the health system. It's naive of all of us to think that they'll call, they'll go to the website only, they'll text only. There is no single point of entry. Tarun Kapoor, who's the Chief Digital Transformation Officer in Virtua, he said this to me in this quote, but he also said in a really interesting way, there isn't a digital front door, there's a digital back door, there's a digital side door, there's a digital trap door. There's lots of different ways for patients to be able to get access to the system, and we need to make that a reality for them. So to have a great experience, which is around that options, we want options, we need to make sure there's more than one way to reach your teams, your patients, your care teams. So whether that's online, whether that's portal, a bot, your phone, whatever other tools that might exist, email even. I've seen some really lean-in clinics like look at Facebook Messenger or WhatsApp and that sort of stuff. Is there more than one way to reach us? Are there channels that we've underinvested in as a system that we're overlooking? A lot of times, patients are going to go to the website first. So, the first place to even find it, even though they know you're going to Hayes Valley Health, they're going to Google Hayes Valley Health first, which makes Google a channel on its own. And then do we have strategies for patients who want to reach us on the web, whether it's that Google experience and who don't want to hold, right? Do we have the self-service opportunities? But it's so critical that no matter what we do here, that pathway, that road in has to be not paved with, not paved with dirt, but paved with smooth cement. So there's multilingual access. You're not hitting bumps if you followed my abusive metaphors there. So don't forget, whatever you're doing, no matter what channel you're putting in front of patients, multilingual access, so critical. Otherwise, patients are going to go somewhere else where they can find providers who can provide service in the language they need. So some actionable tips here on what we can do to provide that great experience when we want to give a lot of options. Obviously, number one, patient self-scheduling. You saw on Tandem Health's website, front and center of the website. And it doesn't matter if it goes to portal, open scheduling, request forms, whatever the way you solve this for your particular health system, make it front and center for your patients. That's going to be one of the main ways that patients get access to your care. Now, of course, we have a strong opinion here at Luma that it should be like real proper open scheduling where patients can get access without needing to go through and wait. But, if as long as we're making front and center, we're on the right path. Secondarily, let's make sure we give patients the ability to wait and hold on other channels. So like using the portal for lab refills, maybe doing text to complete certain workflows, requesting callbacks, being respectful of the patient's time. And then, of course, like I said, multilingual. Now, bucket two, which is have it your way. So you can see we're leaning into a little bit the fast food themes here. But we want you to have it your way with self-service. So if you, again, going back to this class data here, you see so cleanly, so crisply that what patients want is the ability to schedule and reschedule that appointment. So whether it's, being able to get the patient into the appointment the first time, or if their schedules change, being able to reschedule that appointment as well. Without the self-service opportunities, it's sort of kind of one of the hidden truths to where no-shows come from. No-shows a lot of times are patients do want the service, but life has gotten in the way. They have frustration and trouble with scheduling. They try to call to schedule. We have a partner we work with which received 20,000 voicemails a month, which were just patients canceling and then all those patients not being able to rebook their appointments. 20,000 voicemails for staff to check. That's insane. And that leads to unfilled slots. That leads to a lot of other kind of portal messages that may go unanswered. So we want to put these pieces together so that we can actually improve that consumer experience with the self-service. So we're all consumers of healthcare, right? Like you go to the doctor, your kids go to the doctor, your spouses go to the doctor. We're all consumers of healthcare just as much as we are professionals in the world of healthcare as well. And what does it look like from your point of view? What does it look like from when you try to get access to care? I know oftentimes, even in some fairly knowledgeable person's ecosystem, I get frustrated not knowing how to navigate, a portal or not knowing how to navigate a scheduling widget or whatever it is. And sometimes I get frustrated and I pick up the phone and I call. So, are we failing help patients? If we're failing ourselves, most certainly, then we're failing patients as well. So how do we go make that a little bit better? Let's start self-scheduling, self-rescheduling with really straightforward stuff. The sort of stuff that's rote that gives that really great mouthfeel, that really great umami to experience in healthcare. Whether that's your flu shots, your annual wellness visits, your kind of more routine care, your lower acuity care. And then whenever you communicate with patients, make sure it's not a one-way apparatus, right? Make sure it's not just information. Make sure it's the ability to do information and an action, because that's true self-service. When I have a airline flight is canceled, the text message that United Airlines sends me is, "We're so sorry. Here's this link to reschedule to find an alternative flight to get you going to your destination." It sucks. It's terrible. And I hate not being able to get on my flight, but at least I know that I could do something about it. So we saw the options that we provided. We had it our own way. Now let's go talk about change of plans. Now, this is one of the big things, and I said this in section 2 a little bit, which is one of the big underneath kind of hidden reasons in the no-show mountain or molehill is schedules change. Patient schedule change. It's not because they don't want to show up for their appointments, it's because schedules aren't necessarily fixed and people lead complex and very busy lives. So here's a great example from a Luma partner, University of Arkansas Medical Sciences, which was 74%, over 2 out of 3 endocrinology patients rescheduled instead of canceling when given an option. That's so powerful. Those patients wanted to come in for care, but just between the time they booked the appointment and when they were going to arrive, their schedules had changed, their life had changed, maybe something had gone on. But they still wanted to receive care. All fully automatically, 74% of those patients were able to get rescheduled instead of just, disappearing for care and maybe having a condition become more acute. So to build that great experience, we want to tune for short notice appointment changes. Because if you don't, you're going to, what have I been saying now for a couple minutes? High no-shows. A lot of people think that fixing no-shows is about sending better appointment reminders. It's so much more than that. Fixing no-shows and making better no-shows is really about understanding patients as people have complicated, sophisticated lives that need to be respected for being, the complicated, sophisticated folks that they are. Schedules change, which ultimately would, the high no-shows lead to unfilled slots. There's thousands of hours of provider time on any given week in any given health system that goes to waste. Millions of dollars in, a medium-sized health system that really just absolutely goes to waste because we're not filling those slots appropriately. So what do we do? First and foremost, did the patient actually need to cancel? That's a question we should be always asking. Or were they still looking for care, but that time was no longer appropriate for them or available for them? And then were you giving them that reminder? As I said, reminders are not the solution. They're the mountain. They're an iceberg capability. What's under the waterline is this really rich way to engage with patients about their care. It's not just say, "Hey, I need to send 8 reminders to a patient to make sure they show up." Reminders really should be that way to actually get them to respond, reschedule, and understand why they can't arrive. So let's help our patients. Let's help them show up for care. 74% of them wanted to, even though they thought they were going to otherwise cancel. So let's let them self-reschedule. But if we don't let them reschedule, because not everyone can do that, give them the ability to cancel. And then kind of don't let it just be phone calls alone, right? You have to kind of think about all the different spots that the patient can arrive onto, the access points in your health system. And it can't be phone calls alone, because we know without a doubt that self-service rescheduling ability is tantamount to generating more revenue, better care, and lower no-shows. So what does the data show? Patients are 34% more likely to reschedule instead of canceling when it's over SMS. We saw at University of Arkansas, 74% in that very specific line. Across Luma's 700 million data points of doing this, patients were 34% more likely to reschedule instead of straight up canceling. That's huge. That's the difference between a profitable health system and in the black versus a unprofitable health system in the red. And without margin, there is no mission. So being able to get that 34% bump can make all the difference in the world. Cool. What do we want? We got options. How do we want it? We want it our way. And if things change, we got it handled for the patients. Now, number four, let's talk. So we covered the three buckets, like I like to call about access. What does it take to get the patient from the moment they want care to being scheduled? Now it's that kind of intermediate time. They're on the books. They may have rescheduled. They may have moved the dates around a little bit, but we have to ensure that we're in communication with the patient along the way. So without great communication before care, obviously patients are going to miss their appointment. And then they may not be prepared for what they need to do to come in for care. So often we have things like, the parking lot is under construction, or the door isn't working, or the accessible ramp needs help, and patients need to know about that. Otherwise, their ability to actually get access to care is going to be challenged. So how do we make this better for our patients? How do we communicate effectively with our patients? Number one, simple as motherhood and apple pie. Ask them to confirm their appointments. Unless you ask, you'll never know. Gone are the days of appointment messaging, which is like, this is an appointment reminder for your appointment on July 7th, 19th, whatever it was. Like that's like 2000 and late. Those aren't the ways we're going to get our patients to engage anymore. They expect quite a bit more. So first and foremost, let them communicate directly that they are coming, or they need to reschedule, or they need to cancel, whatever it might be. Second, make sure we're answering the important questions up front. After the patient confirms, make sure you ask them, like, before your visit, make sure you bring in your insurance card or bring in your driver's license. If they're coming in for an imaging appointment, make sure you preemptively tell them no perfumes. Let us know if you have any metals in your body, whatever it might be. And then allow the patient to ask questions. For a lot of patients, just simply asking the question that's top of mind, even if it's rote, will be enough to get them to kind of cut over the hill, because they know they talk to somebody at the clinic and that human connection has been established. So let's go back into those actionable tips. This is from data that we have from some of our data here at Luma, which is, let's make sure that we send patients appointment reminders, even if they're not using the portal. Now, I know some people are like, oh, the portal does that. Insufficient. What we need to do is we're getting in front of patients, no matter if they're coming through the front door, the back door, the digital front door, the analog front door, the sticks and wire and twigs and bubblegum front door. It doesn't matter. As long as if they're going to come to our system, we need to communicate with them. Second, let's get them to the right spot to get the answers to their questions, whether that's an FAQ on the page. But some incredible health systems use YouTube videos recorded by their physicians that actually answer questions about the upcoming service. Hi, it's nice to meet you. I'm Dr. Bansod. We're excited to see you here today. I'm going to be doing a prep visit for your colonoscopy. Here's some things we're going to go over in a short 2-minute YouTube video shot on a phone, just like that. So personal, gets them to the right place and gets them their questions answered. But really, it's that communication, that elements of a great consumer experience. And lastly, no one wants to read a novel on their phones. And so we see this all the time where it's like, well, I've got to put in my COVID warning, my this thing, my this, chop it up. 400 characters or less. That's kind of our best practice. That's what we know helps patients get to that result that you want. And then lastly, so we got the patient access, we got them on the schedule, we communicated with them. Now they need to be ready for care. What does that mean? So pre-appointment prep, check-in and intake. So CVO Orthopedics, one of a Luma partner, they gained 1.5 million annually from time and resource savings by making sure they were able to get their patients to do digital prep ahead of their visit. Incredible, incredible work. Because without that, you might experience, we've all lived through this. The clipboard with the paper, your staff is dropping things in scanners, papers get lost. This is, again, to use a metaphor that I'm too old to use, this is so 2000 and late, right? We need to provide a much better experience so that staff are not, we're providing great jobs for our staff, but also providing these great experiences for our patients. Because if the patient isn't ready for their appointment, if financials haven't cleared, that's just not a great experience for anyone, both the patient and the staff member. And, honestly, anyone who's kind of, so to speak, collateral damage to the lobby. I had a Luma partner in Hialeah, Florida, tell me this once, which was, the worst day that we have here is when there's a screaming match in my lobby about money. And the patient feels upset, the staff feels demoralized, and everyone else who's in the waiting room feels that negative energy come with them. So whatever we can do to make that experience go away, we'll know we've built a winning consumer experience. So how do we help? What can we do here? So patients, we can help with some prep ahead of time, whether it's smart messaging, online forms, Can they do their actions they may need to do ahead of time? And can we empower patients to do more in the pre-service timeline? So without that context, make sure you provide it. Otherwise, without context for the upcoming appointment, who can blame them, right? Patients don't know what they don't know. They're not healthcare experts. We are. Secondarily, let's make sure that if those pre-appointment steps haven't been done, we're actually telling the patient that, like, hey, we still need your insurance card, or hey, we noticed your driver's license wasn't on file, or hey, we noticed that there's an outstanding balance. Like, just you might be asked about this before your visit. Being able to put in that automation there, which still feels personal, but provides the patient the context, really can help alleviate a lot of that anxiety. So thank you so much for spending, half an hour with me today. I really love the opportunity to take healthcare and make it more consumer friendly, make it more like that pizza tracker experience. My name is Aditya. I'm the founders and CTO here at Luma. I love pizza, but I love healthcare more. Thank you so much.